Hello, my name is Dr. Carlo Oger, emergency physician for edxitvideo.com. In this video, we're going to talk about thalassemia, which is a blood disorder that is passed down through families, which is to say it's an inherited disorder. In thalassemia, the body makes an abnormal form of hemoglobin, which is a protein inside the red blood cells that carries oxygen. The disorder results in excessive destruction of the red blood cells, and that leads to anemia. Hemoglobin is made of two proteins, the alpha globin and the beta globin. Thalassemia occurs when there's a defect gene that helps control the production of one of these two proteins, and thus the term alpha and beta thalassemia. Alpha thalassemia occurs most commonly in persons from Southeast Asia, the Middle East, China, and those with African descent. Beta thalassemia occurs in patients of Mediterranean origin, and to a lesser extent Chinese, Asians, and African Americans. There are many forms of thalassemia. Each type has different subtypes. Both alpha and beta thalassemias include two major forms, thalassemia major and thalassemia minor. In thalassemia major, you must inherit the defective gene from both parents to develop thalassemia major. It is a recessive disorder. In thalassemia minor occurs if you receive the defective gene from only one parent. Persons with this type of disorders are carriers of the disease and usually have no symptoms. What are the symptoms of thalassemia? The more severe form of alpha thalassemia major causes stillbirth, death on the unborn baby during birth or late stages of pregnancy. Children born with thalassemia major, also called Cooley's anemia, are normal at birth but develop severe anemia during the first few years of life. Other symptoms include bone deformities in the face, fatigue, growth failure, shortness of breath, and jaundice or yellow skin due to the breakdown of hemoglobin. Persons with minor form of alpha and beta thalassemias usually have no symptoms. Signs and tests. A physical exam may reveal a swollen or enlarged spleen, also termed splenomegaly. Red blood cells will appear small and abnormally shaped when looked under a microscope. A complete blood counter, CBC, reveals anemia. A test called hemoglobin electrophoresis shows presence of abnormal form of hemoglobin. Now, let's talk about thalassemia treatment. For thalassemia major, it often involves regular blood transfusions and folate supplements. If you receive many blood transfusions, you should not take iron supplements. Doing so can cause a high amount of iron to build up inside your body, which can be harmful. Bone marrow transplant may help treat the disease in some patients, especially children. What are the expectations or prognosis of this disease? Severe thalassemia can cause early death due to heart failure, usually between the ages 20 and 30. Frequent blood transfusion with therapy to remove iron from the body helps improve this outcome. Less severe forms of thalassemia usually do not result in a shorter lifespan. Because of the hereditary nature of the disease, genetic counseling and prenatal screening may be available for those with a family history of the condition who are planning to have children. Thank you for watching this video.